All right, hello again, everyone, and thank you for joining us at JMT Consulting for our webinar today over visibility, control, and efficiency for your health center featuring Sage Intacct. My name is Megan Mendiola, and I'm a regional marketing coordinator here at JMT. I'm also joined by Mark Brazier, Intacct sales engineer here at JMT, who will be leading us in our webinar today. I'll introduce him to you all here in a bit. Wanted to let you know this webinar is sponsored by JMT Consulting. We are an ERP and financial management solutions consulting firm with 28 years of experience specializing in nonprofits. We work with a wide variety of software partners to find the best solution for your nonprofit. Also, just a few housekeeping notes I'd like to share with you all before we get started. If you have any questions during the webinar, please go ahead and submit those into the question and answer portion on your control panel. We're going to go ahead and save those all until the end of the webinar, but don't hesitate to go ahead and submit those as you think of them. Also, today's webinar recording and slides will be emailed to you within 24 hours following the conclusion of the webinar. And now I want to tell you a little bit more about Mark Brazier. Mark lives in the Oklahoma City area. Before coming to JMT as an Intacct sales engineer, he was actually a CFO himself at a small private college in Oklahoma. This college was a client of JMT's, and they actually implemented Sage Intacct into their own organization under Mark's leadership. He takes all that knowledge with him into how he helps nonprofits now at JMT, and I'm sure he'll tell you a little bit more about that as well. So without further ado, I'll go ahead and turn it over to you, Mark, to get us started.
Thank you, Megan. Good afternoon, and thank you so much for taking time out of your day to join with us today. We want to spend just a few minutes talking about health centers and what JMT can do to help you as you carry out your mission and make yourself more effective. As Megan mentioned, JMT was built to help nonprofits achieve their missions by a team of people dedicated to serving nonprofits. Most of our staff and employees, our partners here within JMT, have worked with nonprofits before coming to JMT. Top of that list is our founder, Jackie Tiso, served as CFO and controller for a numerous number of nonprofit organizations before beginning JMT in '91, because what she saw was nonprofits having to take a back seat to the for-profits in the best of technology. And so as she'd gone through a number of implementations herself with software, decided that there had to be a better way, and thus the beginning of JMT. As Megan mentioned, I have been working with nonprofits most of my life, and for 15 years of that, I was CFO in nonprofits. And so I've sat on your side of the table. I've been where you are as you look at day-to-day processes, and also as you attempt to find what the best solutions are for your office. Your mission is our business. We have thousands of happy nonprofit clients. We do rapid and affordable implementations with our deep nonprofit expertise. And let me reiterate that one more time. That's all that we work with is nonprofits. And so we bring specialty to the table like no one else. As you can see, we have clients all over the United States with offices scattered across the US as well as in Australia. So our goals for today's webinar are these. You've seen these when you received emails concerning this, but we're going to look at how to track and measure performance and key metrics. We're going to look at how Sage integrates with other technology solutions. We're going to talk about HIPAA. We're going to talk about the dreaded UDS reports, and then we're going to talk about how JMT customized its implementation to work with you. So without any more pause, let's step into the stuff. So dashboards. Intacct has a wonderful tool in the dashboards. Dashboards are in real time. Take just a moment and look at these here. As we look at the dashboards, you can see right here, this one is called I've named it row-based dashboard CFO1. The dashboards are totally customizable. And so as a CFO, controller, or whatever position that you hold, you can have multiple dashboards for yourself, but you can also set up and assign dashboards to different staff members in your office, whether it be grant managers or the CEO or CFO, controller, wherever it might be, you have the ability to customize a unique dashboard for those individuals. You can also notice, just quickly, won't spend much time on this today, but Intacct is multi-entity, and so as you grow, it's going to grow with you. You can see here as we look, you can filter these dashboards to whatever you want. Intacct uses what we call dimensions. Others use segments, whatever name that your chart of accounts might have. But in addition to your GL account numbers, you have departments, funds, and up to 10 in the core package. And then you can add user-defined dimensions as you need them. With those dimensions, then you're able to filter the data however you'd like to do it. So this particular dashboard, you can see these are grayed out, has everything, all the data up to 11/30/2018. The default on that is today, but obviously the data in a demo is at different points, and so it's set for 2018. The pieces of the puzzle that you have available to you in the dashboard are these performance cards. The performance cards allow you to keep an eye on key indicators. And if you'll notice here, within Intacct, you have statistical data as well as financial data. And in the performance cards, as well as reports, as you can see right down here, and I'll show you more of that in a moment, we'll go back to that. You can mix these two. So you have your medical visits, and then you have your revenue per medical visit. And so you're able to mix those in your performance cards. In attendance and performance cards, you have graphs that you can create. You can also create static records such as your payables, and then also any reports that are in the system are able to be put on the dashboard and are accessible from the dashboard. And so if you may have non-finance people that need to have information, and they're able to be set up for that on their dashboard, and then they are able to drill down within the report as they need to. Anything within the blue is able to drill down. These numbers such as this are not able to drill down, only because if this was a live screen, if we were to click over here, we would see that there are subcategories under this service fees, and therefore when those opened up, then you would have the ability to drill down. So you're able to drill down into any number, and you're able to drill down all the way to the transaction level. So as we look at this, there's something about characteristics of a best-in-class financial cloud ERP. One is integration. We're going to talk about that, but I wanted to bring up the issue of automation and visibility. As in the dashboard, as I mentioned, it's real time. As data changes, the dashboard changes. And so you're not taking snapshots of data from yesterday or the day before, but you're getting real-time data in the dashboard for whoever needs it whenever they need it. The next step for us today, next point, is the ability to integrate. Sage Intacct, we like to say, plays well with others. That is, it is going to integrate with whatever solutions that you might have. There are two ways to integrate. There is, if you're coming from another software, for example, with health centers, your health records can be integrated and or import-export. And the import-export, I know that there are horror stories about import-export. I'm here to tell you, if using other softwares, the Intacct's import-export is one of the easiest, smoothest transactions that you'll do. Once it's set up, you'll find it very simple to do. But in addition to that, Intacct has what it calls marketplace partners, where integrations are already set up. So there's really three options. There are those that are already set up with integrations. You can do import exports from other solutions, and then you can also integrations can be created to move from whatever other solutions you have. And talking today particularly about health records, but also your payroll, your other expense accounts, your billing software, whatever it might be, can integrate into Intacct. And so one of the things that is so important for us as we talk to clients or potential clients, and I'll mention this every time I do a demo or an alignment call with the client, and that is our goal with Intacct is, and as much as we all love, who are in the finance world, Excel spreadsheets, our goal is to keep us out of Excel spreadsheets as much as possible. Not anything against Excel, but so that we're not having to manipulate that data manually, but that we're able to do an integration or an import export quickly and able to allow Intacct to do that manipulation for you to create the reports that you need and move you on your way. And that is one of the biggest pieces of Intacct, and the reason that we as JMT have chosen it as the top accounting software for us. In addition to that, something that's very important for health centers is the whole issue of security. Intacct has the ability to be HIPAA compliant. In fact, AICPA endorses as the only healthcare accounting software endorsed by them. And so the securities are in, the audit trails are in. There's not a whole lot to show you on this at this quick juncture, but the fact is you can check that off your boxes, that it is HIPAA compliant and able to do what you need it to do. So let's go into one of the day-to-day things that you deal with, and that is reporting, and reporting customized for you. I tell clients every day that I'm relatively sure, because I understand that infinite is a big number, but that reporting with Intacct is almost, excuse me, is almost infinite. The ability to customize to what you need is there, and you will be able to create the reports that you need, again, without going out to Excel and reworking the report. So let's look at just a few of those. This is just a generic report, but I want to point some things out, and this was on the dashboard, if you noticed a moment ago. This is just a statement of revenue and expenditures across the various different groups of accounts. And so as you can see, the clinics, you can see management, general, fundraising, all departments. But also, in addition to that, what I wanted to point out from this particular report is I'm mixing the financial with statistical data. And so statistical data, your visits, your medical visits, dental visits, etc., those can be pulled in, imported from your health records. Mix that with your billing pulled in from your health records and the information that you have in Intacct, and you're able to create the reports that you need, the key indicators, so that you can stay on top of those things and make sure that your nonprofit is able to meet its mission, not only today, but next week and next year. So it's fascinating what it can do. Obviously, the ability to highlight, the ability, I mentioned the blue, being able to drill down, the ability with the triangles on the side to expand these into the areas to sub accounts within these. All of that is right there within the report itself. So if you send this report, or if it's accessed by somebody, say, such as a CEO, and they need to drill down, they're not in the finance office every day. Maybe their expertise is not finance, but they're able to drill down and find the information that they need to do what it do. And there's so much more to that, and we'd love to show that to you sometime one-on-one. Another reports that come up are the UDS reports that just drive FQHCs. Several months ago, JMT made a decision because we saw FQHC struggling with things such as this that are very unique to federally qualified health centers, and the reports that the government requires of you. And so we began to develop reports specifically for FQHCs. And so this is, as you probably recognize, this is from the government's report, the FQHC HRSA reports. This is table 8A, top portion of it. And so that is a report from their documentation, from their reporting system. Here is the report from Intacct. And so we have created the exact same report in Intacct. So set up correctly, set up with the right information, Intacct can provide those reports to you. As we began to do our research with FQHCs, time and again, we heard horror stories of how much time, how many days, how many weeks was taken in completing the HRSA reports. We have endeavored to create set up the dimensions, and it's all from the setup. It's not just a matter of reporting, but how the system is set up. We have customized the system to be able to produce the reports that will get you where you need to go. And all of a sudden, instead of manipulating data time and time again, Intacct is able to give you the reports that you need. In addition to the HA, of course, is the HRSA 9D, and you can see here. And what you're seeing here is an interesting thing. You have your funders in one of the dimensions. Down the left side, your Medicaid, your Medicare, your public funders, private funders, clear down to the self-pay. And then how much of those were charged, how much of those collected, percentage of charges, straight from the HRSA 9D report. I thought it would take just a moment, and we don't have a lot of time today, but to show you some of the way that is done, here is the layout of the funders, which is one of the dimensions that is set up in Intacct, that we have set up in Intacct for health centers. And as you can see, by setting up the parent-child relationship between the various groups of funders, we are able to create the reports that I just showed you. So it's not just a matter of reporting, it is a matter of setup. And the good thing about that is that when you contract and you partner with JMT, what you're going to get is that expertise and that knowledge to help you set up your system, so that 6 months from now, a year from now, you're not looking back and buying a new system and still not doing what you'd like for it to do. We're going to help you create that system so that it fits where your needs are. And that brings us to this point. We are not a software publisher. That we do not create software. We are a consulting firm. Our commitment is to you. Our commitment's not to any particular software. Our commitment's not to any particular software publisher. Our commitment is to you. We curate only the best solutions. I mentioned that a moment ago. The Intacct is one of the reasons that we have chosen Intacct among many others, but one of those I mentioned a moment ago was the fact that they play well with others, and we're able to integrate it from many solutions into Intacct and out. We assemble a perfect for you solution from our ecosystem of best-in-class partners. Our goal is to take care of you. Our goal is not to sell any particular software, but to make sure that you have what you need to run your office the way you do. We're an independent consulting firm, and that is why it should be important to you that with Intacct. Now, let me talk about the final step in the outline, the agenda that we looked at a moment ago. And that is the issue of customizable services and timelines. Intacct, excuse me, JMT has worked real hard to create multiple choices, customizable choices of complexity and timeline as your needs require. We have created the Jumpstart Express up to Jumpstart Choice, and then the comprehensive. Depending on the complexity of your system, this kind of gives you a glimpse of how long. That always comes up, is how long will it take? And from the time that we get things that you sign and we're ready for that first meeting, we can do these in this amount of time. And our consulting teams are ready to do that for you. Another thing about Intacct I wanted to point out today, G2.com rates Intacct as the highest performer. You can see some that have a little bit more market presence, not more, but as far as satisfaction by customers, Intacct leads the way. That is one of the reasons that we recommend Intacct. So that gives you a quick flyby view of Intacct and what it means for FQHCs for health centers overall. You can see that the system is set up to be customized for you. JMT is set up to customize that for you. With as it pertains to health centers themselves, we have done the back work ahead of time and are ready to do that. We have clients today that have bought on because as an FQHC, they've looked at it and said, we struggle with these reports every single time they come up, and this system seems to be the one to do it. And indeed it is, and it will do it for you. And it's not just Intacct, but it is JMT Consulting that will help you get there. So I'm gonna pause right there and let me give my throat just a brief rest and see if we have any questions. I don't know that we do.
Thanks so much, Mark. So I don't see any questions at the moment, but that's a good reminder. If anyone does have any questions over anything we covered today, you can put those questions in the Q&A portion on your control panel and we'll read those out. And I think a question, to just come in, this is a great question, is what's a good next step to learn more? And I can actually speak on this a little bit. It leads me into what the follow-up process is going to look like. So if there are any additional questions or you're interested in learning more, we'll definitely have a chance to talk through that. After the webinar today, I'll be reaching out to everyone individually through a phone call following the webinar for just a more personalized discussion over your organization's needs related to your financial back office to just ensure Intacct would be a good fit and you're interested in evaluating that more. From there, we can move into a formal assessment with a solutions consultant and evaluation from there. So that is a great question. So just be looking out for that phone call or email follow-up from me this afternoon. And I look forward to connecting with you all. And then I think that was the only question that we had come in so far, Mark. While we wait for any more questions to come in, I did want to let everyone know that we have another webinar coming up on November 17th over seamless end-to-end integration of your donor systems. We do highly recommend you get signed up for that one if you enjoyed what you saw today. You can do so on our website at jmtconsulting.com, and that webinar is completely free like all of our webinars are. And let's see, have we had any more questions come in, Mark?
I don't see any right now.
Okay, great. Well, like I said, if you have a question that ends up coming to your mind after the webinar, you'll definitely have a chance to ask it during the follow-up call. So no worries on that front. So before we close out today, Mark, do you have anything else that you want to add?
No, I would just reiterate again the fact that JMT is a consulting firm, and regardless of where you're at in the process or what systems you're coming in with, it's worth the conversation to talk to us and talk to, as Megan reaches out to you to talk, set up some time to visit further and see what we can do for you.
Yeah, great. Thank you so much, Mark. And thank you everyone for joining us today. We just really appreciate your time. We hope you enjoyed what you saw, and we hope you have a great rest of the day. Thanks so much. Bye.